My name is Riad Salem. I'm Chief of Interventional Radiology at Northwestern University Hospital in Chicago.
What sessions and workshops are you participating in?
So PAIRS is always a lot of fun. They ask me to participate in sessions that involve portal vein intervention, TIPS intervention, also cancer intervention like radioembolization. And interestingly, this year I'm participating on novel new concepts for radioembolization.
Out of those presentations that you just spoke about, which one of those would you like to highlight to the audience?
So again, I've given many presentations at this meeting, but I suspect that the one that is garnering most interest has to do with the extrahepatic applications of Y90. We are doing some clinical investigations on Y90 outside of the liver, and certainly this concept of delivering radiotherapy in vessels outside the liver is a new concept for most of us, but it's certainly to push the standards of care forward and certainly generate a lot of interest.
Can you tell us more about that Y90 presentation without giving away too much?
The Y90 presentation I gave had to do with the rationale and concept of applying Y90 to the brain for recurrent glioblastoma multiforme. The idea is that if we can catheterize vessels in the brain and identify small areas that are afflicted with cancer, can we perform radioembolization in small areas of the brain and get good long-term outcomes? Because in this patient population, there's an unmet need and the outcomes are not very good. So can we move things forward by performing really selective radioembolization to brain tissue?
Okay. You gave a presentation on radiation lobectomy. Do you perform a lot of these in your clinical practice?
Radiation lobectomy is the standard of care at our institution. When patients are candidates for resection, they will all undergo a radiation lobectomy unless the future liver remnant is already above 40%. In most cases, it is not, because in cirrhotic livers, those tend to be small and shrunken and diseased, and the potential future liver remnant is too small. At our institution, we in fact, working with our transplant surgeons and our surgical oncologists, will perform radiation lobectomy, most commonly in scenarios that have right lobe disease, where the patient is going to undergo a right hepatectomy or a trisegmentectomy with a small future liver remnant. But yes, at our institution, that is our standard of care.
How do the surgeons value your experience and talent with Y90, especially the impact that you have in helping them manage the HCC patients?
The management of the HCC patient really requires a multidisciplinary approach, and that involves interventional radiologists, surgeons, oncologists, hepatologists, etc. And really, that disease process is one that really is ideally suited to have all specialties involved. From the surgical standpoint, I think they do appreciate our input and our ability to treat, because we're able to downstage patients to resection or transplant. We are able to bridge patients to liver transplant. We are able to augment future liver hypertrophy in the sense of radiation lobectomy. We're able to cure some patients that cannot undergo resection or ablation by using radiation segmentectomy. And we're able to improve outcomes in patients with local vascular invasion with or without systemic therapy. And so all of that is basically a formula for success for the patient in individualizing their care by having everybody involved.
Have you participated in the PAIRS conference before?
I have been to the PAIRS conference many, many times.
Can you tell me how you feel about the changes you've seen over the years to the conference?
The PAIRS conference over the years just continues to improve from the depth of the discussion, of course, the number of attendees, the level of science that is presented, the scientific advances that are discussed, the panel discussions, the symposia. Those all lend themselves to a conference really truly being multidisciplinary and being inviting for all types of subspecialties. But I've seen nothing but very impressive and amazing things from PAIRS from year to year.
What would you like to see in the coming years for the conference?
I would like to see in the coming years more discussion in the multidisciplinary tumor board style that involves active discussion between panelists, but also audience members, because I think sometimes the audience wants to participate and challenge the expert and have the expert better explain what they mean by a certain concept, or They want an expert to rationalize why they made this decision over another. So I think live participation from the audience would be welcome.